So my name's George Smith. I'm an occupational therapist down in Pembrokeshire. So I started, it was mostly just the work I was doing before. So I was a teaching assistant for children with special needs, and I also worked with adults with autism for quite a while. And it sort of just led me down this path of really wanting to work with people, but be more sort of involved in their care, being able to help with rehabilitation and just really just have a little bit more influence on improving their lives if I could. There's a little bit of a shock because suddenly you were the one who was supposed to have the answers. But to be honest, the support that I've had in that transition, moving down to Pembrokeshire, has been really great. I knew I wanted to stay in Wales for a bit longer, and sort of everyone I spoke to sort of recommended Pembrokeshire as a really nice place to be, super close to the sea wherever you end up. And yeah, it's just been really nice to have that change from Nottingham, where there's not a lot of sea at all. If you like activities, outdoor activities, it's a really good place to be. I think at the moment I'm still building up a good range of experiences, which, to be fair, the post down here is really good for, because obviously every 6 months you swap around, build up a good solid base, and then hopefully look to specialise in something that I've really enjoyed. I would actually suggest looking beyond just the job itself and looking at the area that you're actually going to be in and deciding, right, what is, other than the work, what else is there that I want to do with that time. And yeah, just having a sort of broader perspective on it would be my advice. I spend a lot of time writing notes, but again, it's part of the job. I understand why it's important. Sometimes it feels like you're being dragged away from seeing patients, which I don't like as much, but that's the main one really. I've really enjoyed the transition to being a qualified OT. It was what I was expecting. So you can sort of take this job wherever you want to go with it. So I like that element of freedom. Like the sort of support that I've been given as an OT as well. Like other OTs are generally very, very supportive and really good at looking after you and helping you through things.